time. 5, 4, 3, 2, 1. Broadcasting live from the Newsmax studio in New York City. A fusion of politics, commentary, entertainment, and sports. Steve and his team bring you the latest news and opinion now. Here is Steve Malzberg.
Tonight, the only Ebola patient ever on American soil waits to see if his body will fight off the deadly virus. Dr. Kent Brantley, in this biocontainment suit, stepped off the ambulance yesterday under his own power, much to everyone's surprise.
To see him walk, which hadn't even occurred to me, was just unbelievable.
All right, folks, joining us now is Dr. Robert Garry, Director of Virology at the Tulane University School of Medicine. Hello, Doctor. Welcome.
Thank you very much.
Well, thanks for doing this. I really appreciate it. First of all, the condition of the two Americans who have now both been brought back. We saw the first patient walk off that ambulance. I'm not sure if the woman did today or not, but talk about why they are in such relatively good health.
Well, this virus, this Ebola virus, is not quite as lethal as some of the other viruses that have emerged in Central Africa. So people tend to stay healthier a little bit longer. And that's actually part of the problem in West Africa. People are ambulatory, they walk around a little longer, and they can spread the disease to other people easier because of that. So I was very happy to see the good shape that the doctor was in, but we've seen that in other patients in West Africa as well.
All right, so there were different types of the virus right now making its way through Africa, correct, is what you're saying?
Well, the previous outbreaks have all been in Central Africa, okay? And so these are the ones that are people have claimed to have 90% lethality and, very deadly viruses.
Right.
The strain that of the virus that came out in West Africa is related to those from Central Africa. It just turns out that it's a little bit less lethal. It doesn't make you quite as sick. It still kills over 60% of the people that have been infected with it, but people tend to stay healthy a little bit longer.
All right, talk about this serum, this experimental serum that reportedly both of the American doctors who are now back in the States have been treated with. Is this well, first of all, have we known about this serum for some time? Is this relatively totally experimental and right out of the blue new? What do you know about it?
Well, it's not actually a serum. I mean, people have been calling it that. I'm not sure why they did that, but it's actually a mixture of molecules that we call monoclonal antibodies. Now, your body makes antibodies. They help ward off diseases. And what was done in this case was animals were immunized, exposed to Ebola virus, and their bodies responded to that virus. And then people took the antibodies and used molecular cloning. They made them so that they could be expressed in plants, in bacteria, in mammalian cells, other expression systems for these antibodies, and they made large amounts of them, so that instead of actually waiting for your body to make the antibodies to fight off the virus, the idea here is to use these antibodies to sort of give your immune system a head start with these laboratory-created antibodies.
So this is a treatment for those who have already come down with it, not a preventive measure such as a vaccine or someone who might be sick. Well, although you might be able to give it to somebody who might be sick and you don't know yet if they have Ebola?
It could be used in both ways, actually. It could be used to prevent the infection as well.
As a vaccine?
Well, not exactly a vaccine, but as a preventative measure.
Gotcha.
You could use it both ways. Hopefully, it works as a treatment just as well as it would work as a preventative.
So, do you see this as something that will become widely used very shortly? What if it is successful? How hard is it to make enough of these, or stock up on these?
Well, you hit upon the major issue here, and that's the scale-up of these. There's very little of these antibodies currently available, and that next step in the process to make a lot of them takes a lot of technology, a lot of work, a lot of development. So getting grams and kilograms of these antibodies is an industrial-scale process that will take years to achieve. And remember, these are experimental treatments, too.
Right.
So to get approved by the FDA, they're going to have to be proven to be safe. They're going to have to be proven to be effective, and that's a process that takes several years.
So even,
but
yeah, I'm sorry to interrupt.
promising.
Yeah, but
they're
even,
promising.
yes,
so let's do it.
They're promising. Okay, but so even if these two doctors, and we hope they overcome this and don't die and recover eventually, we're still years away from this being readily available to the public, is what you're saying, in this country.
Well, I mean, hopefully we can accelerate that process, because there are also Africans that are dying of this disease too, and so we want to step up our game for them as well. And I just want to caution, I mean, this is a small trial done on a compassionate basis. I agree we should do that. We put these people in Africa in harm's way. We need to send the right message that when Americans go into a harmful situation, that we're going to do all we can to protect them and and to treat them if they happen to come down with a disease like Ebola. So it was the right thing to do. But it's only 2 people, and
right.
So as a scientist, we know that when the number of people that you treat is very small like that, you can't draw general
Sure.
conclusions.
All right.
So we don't know. There'll be a lot more tests that need to be done.
Now, I don't think that you're concerned about the 2 people who came back with all the precautions that were taken as far as them spreading the disease to anybody else, although I don't know that anything is 100% certain. But what about, we have a person, at least one, maybe as many as 6 in New York City that are being tested for the virus. We have a woman now, report of a woman in Ohio being tested for the virus. Is this not inevitable as long as we have planes flying in and out of this country from infected countries and countries where the infected might go and fly into here? Isn't it just a matter of time before Ebola, if it's not already here on our shores, is coming?
Well, the more people that get infected, and the longer this is allowed to spread, the chances for that scenario happening increase. There's just no 2 ways about it. So, we need to be vigilant in our developed countries. We need to watch out for people coming from those countries that have the symptoms of Ebola and test them. I mean, that's what we need to do.
So you're saying at airports?
There are already procedures in place at airports. Every major airport where international flights come in have isolation rooms, people that are trained to look for infectious diseases. So this is already in process. Could a person slip through before they were fully symptomatic? Yes, absolutely they could. Would that person touch off an epidemic like is currently going on in Africa? Absolutely not. With our healthcare system, our better communication, the way that things are done here, we could bring it off fairly soon. But that's not to say it wouldn't be a serious incident. There could be, a dozen people, say, infected, which
that's
we
what I'm
definitely don't want to happen.
Oh, you're saying
it wouldn't be hundreds or thousands.
Well, you're saying a dozen from that one. But
Yeah,
what if you have several who slip into the country?
Then multiply it out. But it's just not going to be you're not going to have 1,000 people infected in the United States. We would stop it well before that.
And you don't see any need to, for instance, United Arab Emirates has stopped flights from Guinea. You don't see any need to put a halt to flights until this is contained in Africa?
That decision is not really up to me. British Airlines has already said that they're not going to fly into Sierra Leone and Liberia. So, that.
No, I know it's not up to you, but you're a director of virology at Tulane University Medical School. Would you like to see that happen?
We need to get people into those countries to shut down this outbreak. So I'm very concerned about that. If there are alternative ways to get people in.
No. Doctor, I'm not talking about volunteers who want to go in. I'm talking about normal commercial flights of people coming out into this country. Should we monitor that? Should we stop those flights?
At this point, I don't really see the purpose of that. But I am concerned that if the airlines do shut down, that we won't be able to get in our healthcare workers and get them in and get them out.
Well, you'll always get a private plane. I mean, I don't see that.
It's not that easy. It's not that straightforward. We would have to do that. The military would have to get involved to bring people in and out. But that's a whole other level of logistics that. And as I said, that may be out of our control. The airlines may well decide that they need to not go in there for a while, just like British Airlines did today.
Do we know, are our hospitals prepared for Ebola?
Oh, some are, some aren't, but I can assure you that most of them are getting geared up to respond and the American people don't really have to worry about this being a major outbreak. We do have to be worried about the point instances, though, of this virus.
And how do you get it? Can you get it from if someone sneezes on you? You get it? You could.
Sneezing, I think, not likely. That would be more like the aerosol route. Generally, the idea is that you have to come in contact with a bodily fluid, like blood, like the vomit, or the diarrhea. Those are the ways.
Well, come in contact with it, and so through your hands, skin, or eat it, or drink it.
Well, just coming in contact with it, probably not. But if you get it into your mucous membranes, and let me explain that: the eyes, the mouth, genitals.
If you breathe it in, if someone sneezes and you
to get into your body.
Right. If someone sneezes and you breathe it in, though, if they sneeze and you're right in your proximity and it's out there in the air and you walk by them, or they cough and you walk by them and you breathe it in, no?
Yeah, there's no evidence that it gets spread that way. That would be like the flu or other things like that. So there's just not enough of the virus in, say, your normal nasal secretions or anything like that.
Right.
If somebody's coughing up blood and they cough up blood in your face, then yes, that would be.
So you say as I leave you here, you see a chance that there might be small outbreaks, but nothing major in this country.
There could be points where a person comes in and affects a few other people. That would be the worst case scenario that I would see for the United States.
All right, Doctor, thank you very much for your time, sir. Appreciate it.
Thank you very much. Good question.
Thank you, Dr. Robert Garry. I'm a devout hypochondriac, doctor, so it's natural for me to ask good medical questions. Anyway, thanks for joining us. And interesting. I don't know if I want to chance it, folks. I really don't want to chance it. We'll be back with the Malzberg panel. You want to reach us on social media? Here's how you can do that.